Now, I do a trick, though, with doctors, and it's the flip side of it, and
Okay.
it's something that I used to do in my practice all the time. If you know a patient is coming in and they need extra time, schedule them in a smart way.
Okay.
Put them at the end of your day.
Oh.
Put them before lunch. Okay, you might have a shorter lunch, but it's easier than having them smack dab in the middle of the day, and now you're worried about backing up all the other patients.
Yes.
And so I think those little tricks will help people relax and get the history that needs to be obtained.
Yes.
You know, because sometimes when we're thinking too much about I'm behind, then we miss things in our haste.
Yeah.
The other thing that I tell physicians is if you think that maybe this is Lyme, give the patient a Lyme symptom checklist and send them home to fill it out.
Yes.
And then they can come back and you can review everything.
Sure.
Because you really don't have to get the diagnosis that very day. If it takes, you know, a few visits to figure it out, that's not the end of the world.
Right. And to get it right. That's
Yes.
so important.
Right.
Because we don't want it to get worse, and then they'll give you a drug, and it's you actually gave them the wrong one, and they could have been taking that other drug to help the Lymes as well. So can we back up a little bit about that as well? You had mentioned that you would have given them the wrong medication for that. And so what is it that you recommend for that person, and also that you're teaching the chiropractors?
Well, like for that rash there, when you're not sure if you have cellulitis or Lyme disease,
Yes.
then probably the best drug is something called, it's a combination drug called amoxicillin and clavulanic acid. And there's a trade name, but you know, usually now in medicine we try to use the generic names.
Sure.
But since your is a general public audience, so that would be Augmentin.
Okay.
Okay, and that would be an appropriate drug.
Okay.
Another drug that you might use is something that's called Ceftin.
Okay.
So that is an important point, Tina, because you want to get things right. And I flip that around for my patient audiences, though,
Okay.
because I want to tell them that the goal is not to be diagnosed with Lyme disease. The goal is to be diagnosed correctly.
Yes.
Because sometimes patients are convinced they have Lyme disease, yet when they tell me their symptoms, I'm thinking, no, I think that you're more in this direction. And so I don't want people to always see Lyme everywhere.
Yeah.
Yeah.
And there are so many different things out there and how it affects people. And with your education and your knowledge, then you can give them that actual piece of paper and saying, well, this is what we've found that you have these symptoms. And then they can do a little check-off list.
Right.
Because people are educating themselves a lot more and going to the internet and saying, oh yeah, that's one of my symptoms. But it's either all, they have to have a lot of the symptoms, perhaps 90%, or you need to send them and know that the diagnosis that you give them is the correct one so that they can benefit their life.
Right.
Yeah.
And you raise some great points. With Lyme disease, it's very helpful to have a symptom checklist because we would expect people to have symptoms in all sorts of different body areas.
Sure.
And having a checklist kind of organizes people's thoughts. And I don't think they need to have 90%, but I'd want to see more than just a couple.
Sure.
The other thing about a checklist is it is just an organizational tool. And then with people using the internet, I think the internet, there's a lot of good websites out there. What I do tell people, though, is you want to have credible information. So I don't suggest getting your information from a chat room.
Oh, sure.
Okay, because that I've been in some of those chat rooms, and it can get kind of crazy.
Yeah. So could you put out to our viewers what some great resources for the information
Well, you know,
are?
Minnesota-Lyme-Association has worked very hard on its website. And so that's MN-Lyme.com. And so that's a wonderful site. There is the Lyme-Disease Association, the national organization, has a very helpful site.
Okay.
And so does the California Lyme-Disease Association.
Wow.
And so those are wonderful sites. The Minnesota Health Department has some good information on their sites.
Sure.
And so does the CDC, although some of the things on the CDC I don't necessarily agree with.
Okay.
But they really have reliable information.
Yeah.
And I do want to stress that you want your information, and not just for Lyme disease, but any internet information. Make sure you have another source that you can confirm it with.
Sure. Yeah. And we want that person to get healthy and better and be aware of their own health, and also always refer to a physician.
Right.
After.
You know, I used to tell my patients that I might know medicine, but you're the expert on you. And patients need to remember that they are an expert on themselves. And so if something doesn't feel right to them, they're probably correct. And so they want to bring that to the attention of their physicians if they're not feeling right.
Right. Well, we only have a minute left, and so
time
I want
goes
to
so
thank
quickly.
you so much for coming and educating my viewers. But is there any last-minute thoughts that you want to throw out to my viewers?
I think the most important thing to do is have your viewers know that Lyme disease is very prevalent in our state, and it can take a variety of forms. And so do your best to prevent it and use preventative techniques.
Yeah. Well, thank you so much. I really appreciate this.
Oh, it was wonderful. Thank you, Tina.
Thank you so much for joining us. And if you have any questions or would like more information, please contact the Minnesota-Lyme-Association. And thank you so much, Dr. Maloney, on all this great information and bringing it out to my viewers.
Oh, you're welcome. It's my pleasure.
Okay. I look forward to having you view other shows of Knowledge for Wellness, or visit my website at knowledgeforwellness.com, and you can find out about more information in your local area. You can also connect with me on YouTube, LinkedIn, Twitter, or Facebook. And I hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, be well and goodbye.
That you would love me so gently, who am I? That you would recognize my name, Lord, who am I? That you would speak to me so softly, conversation with a love most high, who am I? Well, amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found, was blind, but now I see. And the more I sing that sweet old song, the more I understand that I do not